A typical gender dysphoria history, well, the children could have preference for friends of the opposite sex. So this image illustrates a boy, a transgender boy, who has a preference for girls, friends who are girls. Secondly, transgender people may have a preoccupation with wearing opposite gender's clothes. And if they're a boy, they may prefer to sit down to urinate, and if they're a girl, they may prefer to stand up. They may believe they were born into the wrong body. They may routinely request medication or surgery to change their physical appearance. Women may bind their breasts, have mastectomies, take testosterone to deepen their voice. Men, on the other hand, they may have electrolysis to remove body hair and take estrogen to change their voice. And they may also have surgeries to remove the penis and create a vagina. So, how do we diagnose trans individuals with gender dysphoria? Well, DSM-5 criteria states that two of the following need to be present for at least 6 months. A marked incongruence between one's experienced gender and the assigned gender. Secondly, a strong desire to get rid of one's primary and or secondary sex characteristics. Third, a strong desire for the primary and or secondary sex characteristics of the other gender. Fourth, a strong desire to be the other gender. Fifth, a desire to be treated as the other gender. And lastly, a strong conviction that one has the typical feelings and reactions of the other gender. So how do we treat individuals with gender dysphoria? Well, there are a range of different treatments that can help alleviate gender dysphoria. However, these treatments aren't always widely available. Many trans individuals who experience gender dysphoria seek gender-confirming medical interventions. These include hormone treatment and/or gender-confirming genital surgery. Gender-confirming medical interventions may alleviate gender dysphoria, therefore potentially preventing or reducing mental health issues experienced amongst the trans population. However, previous research has been inconclusive about the effectiveness of gender-confirming medical interventions in the reduction of mental health issues amongst trans individuals.
Guys, thank you very much for watching. Make sure that you like this video if you like it. If you don't like it, then do unlike. Like this video, subscribe to the channel, and please share this channel with others as well.